According to the WHO, laboratory analysis of Maiden's cough syrup confirms, quote, unacceptable amounts of substances that can be toxic when consumed.
Hello everyone, welcome to Topic of the Day. In today's video, we shall be discussing about the cough syrup's death in Gambia. Recently, the World Health Organization issued a global alert over 4 cough syrups manufactured in India, which are likely linked to the deaths of around 70 children in the Gambia. Now, the Gambia is a country in West Africa. Senegal surrounds the Gambia on 3 sides except for its western coast on the Atlantic Ocean, and it is the smallest country within mainland Africa. It derives its name from the Gambia River, which runs from the Fouta Djallon Plateau in North Guinea westwards through Senegal and the Gambia to the Atlantic Ocean at the city of Banjul. Banjul is the capital of the Gambia. Now let us talk about the recent deaths in Gambia. In the last few months, there was a sudden increase in the cases of children between age of 5 months to 4 years reporting to hospital with acute kidney injury. An investigation by the WHO linked the acute kidney injury in the children to the following 4 cough syrup variants: promethazine oral solution, Cofexmalin baby cough syrup, Markov baby cough syrup, and Magrip N cold syrup. These were manufactured by the Maiden Pharmaceuticals Limited based in Sonipat, Haryana. Now, the WHO said that each of the 4 products contain unacceptable amounts of the diethyl glycol and ethylene glycol. These are illegal adulterants that may be used as solvents in liquid medication. Common solvents such as glycerine and propylene glycol are used in cough syrups to provide a liquid base to the non-water soluble paracetamol. These solvents also act as preservatives, thickeners, sweeteners, and antimicrobial agents. However, in order to cut expenses, manufacturers sometimes substitute non-toxic solvents such as glycerine with diethyl alcohol and ethylene glycol. Now let us talk about the risk of diethylene glycol and ethylene glycol. These are toxic to humans, especially in children, when consumed, and can prove fatal. In 2020, 17 children died in Jammu and Kashmir after consuming a syrup with high levels of diethylene glycol. Toxic effects can include abdominal pain, vomiting, diarrhea, inability to pass urine, headache, altered mental state, and acute kidney injury, which may lead to death. Now let us talk about the acute kidney injury. Acute kidney injury is also known as acute renal failure. It is a condition where kidneys suddenly stop working properly. It can range from minor loss of kidney function to complete kidney failure. AKI normally happens as a complication of another serious illness. It's not the result of a physical blow to the kidneys, as a name might suggest. Now, most cases of AKI are caused by reduced blood flow to the kidneys. It can also be caused by a problem with the kidney itself, such as inflammation of the filters in the kidney, the blood vessels, or other structures in the kidney. Now, are these products available in India? The 4 medicines were manufactured by the Haryana-based company only for export to the Gambia. These 4 drugs are not licensed for manufacture and sale in India. Further on, following the WHO's report, the Haryana government has ordered a complete stop on production of the cough syrups. The government of India has set up an expert committee to examine the report by the WHO. So this was a little bit about the topic. Now let us take up one practice question on the same. Consider the following statements relating to diethylene glycol and ethylene glycol. First, these are toxic to humans, especially in children when consumed, and can prove fatal. Second, toxic effects include diarrhea, inability to pass urine, and acute kidney injury, which may lead to death. Now, which of the statements given above are correct? You can take a moment and write your answers in the comment section below. So as we know, both of the statements are correct with respect to the diethylene glycol and ethylene glycol. Therefore, the correct answer is option C, both 1 and 2. And with this, we call it a wrap of today's edition of Topic of the Day. I hope you liked the video. I will see you with some other topic tomorrow. Till then, take care and do stay tuned.